I think the most important question is, what is the long-term plan for controlling my pain? Pressure is a common cause of pain in people with HS. It's actually the most common. When you have an HS flare-up, there's a lot of swelling that puts a lot of pressure on the skin around it, and that's something that can be very painful. Finding ways to relieve the pressure of these HS lesions at home can be really helpful. Things like warm compresses on the area where you have the HS. If you have a dedicated hot pack that you put in the microwave, that works too. The purpose of that is actually to increase the pressure and swelling, causing the nodule to burst. I'm sure if you've ever had HS lesion burst, you realize that as messy as it can be, that does help the pain to become relieved. You want to educate yourself about some of the over-the-counter things that you can do to treat your HS. Things like ibuprofen and acetaminophen, and really using those things aggressively, taking the maximum dosages of both of them together potentially for a couple of days. Remember that the pain from HS comes from the inflammation in many cases. And so you don't want, and you shouldn't settle for, a doctor only treating the pain, just giving you pain medication. They really need to get to the root of the problem, which is the HS itself. Another pain management tip that I would recommend is keeping your follow-up appointments. HS is a chronic condition. It's a long-term disease. And so if you're doing some things that work and everything is going great, don't assume that you're cured and you can just stop everything all at once and it's not going to come back. Have discussions with your dermatologist to come up with a plan for you. They don't want you taking medication that you don't need. So that plan at the next visit, if everything is going great, will likely include backing off of your medications, but doing it in a deliberate and strategic way. You are not alone. 1 in 100 people throughout the world have HS. So that's millions and millions of others that are dealing with this condition with you. And you can lean on them for support and lean on the physicians who are out there trying to do a good job of taking care of this serious condition. Learn more about HS at myhsteam.com.